Hi everyone, my name is Sabrina and I just want to share an experience of moral distress. I just wanted to share an experience I have had of moral distress that happened early on in my nursing career. So I've only been a nurse for a year now, and this happened when I was about 3 months on my own. We were short-staffed and one of my confused patients kept trying to get out of bed. And the situation was that I followed the protocol. There was bed alarms. There was false signage. The bed was in the lowest position. I even told my charge nurse, but during the shift, the patient had fell. But thankfully, it was just a minor injury. But still, afterwards, after I got off work, I still felt very guilty. So next, I'll talk about my moral distress. Basically, even though I know I did what I could, I kept replaying the moment. I wondered, should I have pushed harder for a sitter? Should I have stayed longer in the room? I kind of felt like I failed this patient, and that weight felt very heavy afterwards. I did have some supportive mechanisms in decision making. Afterwards, I filed something called an IRIS report, which is like a safety report. I also asked to debrief with my educator at the time, and talking it through helped me realize that I did follow the protocol. I did do everything I did everything I needed to do at the time with what I had. And I also learned that sometimes like following a checklist isn't always enough. And that I needed to speak up louder and escalate when I felt like something wasn't right. Next, I'll talk about how this changed me. This moment taught me how to truly advocate. Now I'm more vocal about fall risks and staffing issues. I call the house supervisor more often when I have to. I also trust my intuition a lot more, and it made me more stronger and confident as a nurse. And my ethical reflection, I would say, is that this experience reminded me that it is our ethical duty as a nurse. Our ethical duty as nurses go far beyond protocols. It's about being able to be the patient's last line of defense and just making sure we're protecting their safety, and not just on paper, but actually in real time. After the incident, I did reach out to Lyra Mental Health. It's something that my job provides to those who work at Memorial. And I had a few sessions with that therapist because it was really tough afterwards at that time for me as well. I also talked to a nurse mentor that I really trusted, and both of those systems that I used helped me realize that it's okay to feel deeply, and that having this type of distress isn't a weakness, it's just a part of being a human. And finally, what I took away is that moral distress, while painful, became a turning point. It taught me to use my voice, to speak up, and to lead with heart. And now I see that it is a sign and a reminder that I care, and that I'm in this profession for the right reasons, and that sometimes when we need to grow, it does come from a place of discomfort. And finally, I just wanted to share this moment because I know that many of us, or many of all of us, will face similar moments, and we talk about it and we get support, and hopefully we continue to let it shape us and not break us. Thank you.